Welcome back to our Advanced Caregiver training series. Today, we're diving deep into some of the most critical skills you'll need to provide exceptional care. We'll cover everything from medication reminders to advanced dementia communication and so much more. Let's get started. First up, medication reminders. This is a big one, so let's be clear about our role. As caregivers, we can remind clients to take their medications. We can read the labels out loud for them, bring them their pre-filled medication organizers, and observe to make sure they've taken their pills. It is also our job to report any missed doses to the office or the client's family right away. Now, what we cannot do is just as important. We are not allowed to open pill bottles for them, place pills directly in their mouth, or decide when they should take their medicine. We don't determine the dosage, handle injections, or apply medical patches. And a crucial point, we never fill pill boxes ourselves. That's a job for a family member or a nurse. Always remember to document. When you've given a reminder, note if the client refused or seemed confused, and report any changes immediately. Next, let's talk about transfers and mobility. This is where proper technique saves both you and your client from injury. We often assist with transfers from a bed to a wheelchair to the toilet, in and out of a car, and with sit-to-stand assistance. The golden rule here is proper body mechanics. Always keep your back straight and bend at your knees, not your waist. Keep the client as close to your body as possible to maintain your center of gravity. Avoid twisting your torso. Instead, pivot your feet, and whenever a gait belt is available, use it. It's an invaluable tool for safety. But there are times when you should not attempt a transfer. If your client tells you they feel dizzy, complains of pain, or seems unusually unstable, stop. If you feel unsafe or the environment is hazardous like a wet floor or a cluttered path, it is better to wait and get help. Your safety is just as important as the client's. Moving on to household management. A well-organized home is a safer home. This includes helping with organizing clothes, arranging medications in a visible area again, without handling them, and keeping high-traffic areas clear and clean. Kitchen safety is paramount. Always do stove and oven checks to make sure they're turned off. Check the fridge for expired food and ensure everything is stored properly to prevent foodborne illness. Laundry is another area where we can help. This means sorting colors, washing delicate items safely, folding neatly, and always cleaning up after ourselves. A tidy space reduces stress for everyone. Let's discuss hydration and nutrition. Proper hydration is a game changer. It helps prevent confusion, reduces the risk of falls, maintains energy levels, and can even prevent urinary tract infections, or UTIs. Encourage hydration by offering water throughout your shift. Find out what their preferred beverages are. Sometimes a favorite juice or tea can make all the difference. Always be on the lookout for signs of dehydration like dry mouth, dark urine, or lethargy. While we don't create meal plans, we do need to be aware of special diets, such as diabetic, low-sodium, soft foods, or pureed diets, and report any issues we observe. Now, let's touch on a sensitive but vital topic, managing client anxiety and depression. It's common for clients, especially those with chronic conditions, to experience emotional distress. Look for signs like social withdrawal, increased irritability, a loss of interest in hobbies, changes in sleep patterns, or persistent sadness. Our role is to provide compassionate support. Use calm communication, offer encouragement, and be an active listener. Sometimes, just being present and engaging them in a gentle activity is the best thing you can do. Offer reassurance and a steady presence. However, if a client expresses feelings of hopelessness, has sudden and dramatic mood changes, loses their appetite, or starts refusing care, you must report this to the office immediately. Next, client boundaries and self-protection. To protect both the client and yourself, never handle a client's money or access their personal documents. If a client has aggressive tendencies, avoid being alone with them without a clear plan or backup. Protecting yourself is part of the job. Keep your phone accessible, stay aware of your surroundings, and never enter an environment that feels dangerous. Report any form of harassment or abuse without delay. Your well-being matters. Let's move to advanced dementia communication. When communicating with someone living with dementia, your approach is everything. First, use validation. This means accepting their reality, even if it doesn't match ours. If they say they need to go to work, you might say, "It sounds like work is really important to you," instead of arguing. Second, redirection. Gently shift their focus to a pleasant activity. You could say, "Before you go, would you help me look at this photo album?" Tir, reassurance. Repeat comforting phrases like, "You're safe here with me." Finally, simplicity. Give one simple instruction at a time. What should we avoid? Arguing or correcting them harshly is never productive. Don't rush them through tasks, use a loud tone, or make unnecessary physical contact that might startle them. Patience and gentleness are your best tools. Now, for bathroom and incontinence care. This requires the utmost respect for the client's dignity. When assisting in the bathroom, offer privacy as much as possible. Ensure the floors are dry to prevent slips, keep grab bars clean, and be ready to support their balance. For incontinence care, always wear gloves. Clean the area gently but thoroughly and dispose of used products properly. Your attitude makes all the difference. Be respectful and professional. Report any new rashes, a sudden increase in accidents, a strongodor, or any confusion during bathroom mass. For those of you working night shifts, your role is crucial for safety and comfort. Your primary responsibilities are to monitor the client's safety. Assist with any nighttime bathroom needs, keep noise to an absolute minimum, and respect their established sleep routines. To prevent nighttime falls, always leave night lights on. Keep pathways clear of obstacles and encourage the client to move slowly if they get up. You should call the office immediately if you notice extreme restlessness, changes in breathing, disorientation, or wandering. Let's talk about client engagement and activity planning. Keeping clients active and engaged is wonderful for their mental and physical health. Safe and enjoyable activities include listening to music, doing puzzles, gentle exercises, arts and crafts, reading aloud, looking through photo albums, or even some light, supervised cooking. The benefits are huge. It can reduce depression, improve memory, increase mobility, and strengthen social connection. Next, advanced infection prevention. High-risk areas in a home are the kitchen, bathroom, and laundry. Also, pay close attention to high-touch surfaces like doorknobs, light switches, and remote controls. Preventive techniques are simple but effective. Wear gloves for cleaning, sanitize surfaces regularly, handle trash safely to avoid contamination, and never, ever cross-contaminate, for instance, by using the same cloth to clean the bathroom and the kitchen. Finally, let's cover client transitions, specifically from the hospital back to home. This is a vulnerable time for a client. Your role is to help them settle back in comfortably. Encourage them to rest, prepare light and easy-to-digest meals, and assist with getting them comfortable and back into a gentle routine. Your main job is to observe. Watch for any signs of weakness, dizziness, new swelling, confusion, or increased pain. These could be signs of a complication, and you need to report them right away. Whew, that was a lot of information, but every single point is key to being a top-tier caregiver. Mastering these skills will not only make you better at your job, but will profoundly impact the quality of life for your clients. Thank you for watching and for your dedication to compassionate care. Be sure to subscribe for more advanced training videos. See you next time.